All right. Assalamu alaikum, everyone, and welcome. Try to get my screen together. And welcome to the conversation this evening. Can everyone hear me? Just thumbs up for those I can see. Okay, good. Thank you so much and welcome. It is now 7:33 p.m. on the East Coast, and we're going to go ahead and get started. All right, I can see folks now. Good. Okay. Just going to share my screen and get started. Oh, there. All right, Bismillah. So, Assalamu alaikum wa barakatuh. Thank you once again for joining us. Thank you for joining us. We will begin this courageous conversations with Quran recitation by one of the youngsters in the community, Umar Al-Farouk. So, Umar, go ahead and unmute yourself.
Assalamu alaikum.
Alaikum assalam.
Bismillah ar-Rahman ar-Rahim. لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما كسبت. And that means Allah does not burden a soul beyond what it can hear, or what it can bear. فإنما العسر يسرا إنما العسر يسرا. And that means, for indeed with every hardship there is relief. Indeed, with every hardship there is relief.
Thank you for that, Umar Al-Farouk. Jazakallah khairan. We're now going to get started. My name is Demi Fauzia Adibo Adilaja. This event is co-sponsored by the Afia Project and the Islamic Social Services Association. So what exactly is the Afia Project? Al-Afia is an Arabic term that encompasses the well-being of an individual. It includes being in the state of good health, being safeguarded from afflictions, and having adequate sustenance. The Afia Project is a nonprofit organization formed to address health disparities experienced by minority members of the Prince George's community and beyond. We endeavor to make a significant contribution to the health, educational advancement, and well-being of our Muslim minority community members through community-based activities and events such as what is to take place here tonight. I will have my co-facilitator for this evening, Dr. Anisa Nadir, introduce the organization she represents, the Islamic Social Services Association. Dr. Nadir?
Assalamu alaikum and good evening, everyone. It's a pleasure to be here with you all this evening, and thank you, Dr. Fauzia. It's been a wonderful opportunity to work with you over these past few weeks to plan this project. My name is Anisa Nadir. I am a retired Arizona State University professor and a social worker with over 40 years of experience. I also own and operate Dr. Anisa Nadir and Associates, which is an organization that addresses health and wellness as well. So it made quite good sense for us to work together with the AFIA project. I also serve as the president of the Islamic Social Services Association USA, which is a trailblazer in this arena. We've been around for 21 years now, advocating for and cultivating the voice for mental health, social services, and family awareness about family issues within our community, and as well among professionals in the larger society. So it is a pleasure to be with you this evening, and we look forward to the conversation that we're going to have this evening.
Thank you so much, Dr. Nadir. So here's our agenda for the evening. We've covered Quran recitation and introductions. Next, I will give a brief presentation of mental health and the Black community. We will then share a short video clip that we want you all to react to and give us your feedback. After the viewing, Dr. Nadir will introduce the expert panelists who will also give us their takes on the video clip and share some information with us from their fields of expertise. This wouldn't be a community conversation if we don't get to hear from the community, right? In order to do that in an orderly fashion, we will create small group discussions led by each of the expert panelists using the breakout rooms. We will reconvene as a whole group after about 15 to 20 minutes to share back what you all discussed in the smaller groups, and share how we would like to move forward as a community when it comes to our mental health and well-being. We have time constraints tonight, so please, we would like to get through all of this and end no later than 9 p.m. so that those of us on the East Coast are able to get to pray our Salat al-Maghrib relatively on time. Okay. I'm not sure if this is really public knowledge, but in 2008, July was designated as National Minority Mental Health Awareness Month. One of the things to note about mental health condition is that it does not discriminate based on race, color, gender, and certainly not based on religion. Anyone can experience the challenges of mental illness, regardless of their background. However, in America, your background and identity can make access to mental health treatment much more difficult. So what is mental health? Well, it is something many of us whisper behind closed doors, but we hope that by the end of this event, we will all talk about it more in the open. Mental health is an important part of overall health and well-being. It includes our social and emotional well-being. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Mental illnesses or disorders are the conditions that affect one's thinking, one's feeling, and one's behavior. You may be surprised about how prevalent mental illnesses are in the United States. These two statistics surprised me the most. That there are 1 in every 5 Americans will experience a mental illness in a given year. And also 1 in 5 children, either currently or at some point during their life, will have a serious debilitating mental illness. This means that chances are we all know someone who is experiencing a mental illness or even a child who is affected by it. There is no single cause for mental illness. A number of factors can contribute to risks for mental illness. These include things like early adverse life experiences, medical conditions, biological factors, drug and alcohol use, loneliness or isolation. According to the organization Mental Health America, this is what mental health looks like for the Black and African American communities. This infographic says about 16%. So about 16% of Black people reported having a mental illness in the past year. And this was in 2018. So 16% compared to the 20% of the overall population seems lower, but the problem is that this percentage is inching upwards for the Black community. It's been inching upward for years. So some of the things to note is that 16% of Black people reported having a mental illness, and about 22.4% of those reported a serious mental illness over the past year. Socioeconomic status plays a role. Poorer Black people tend to experience more serious psychological distress. And definitely the ongoing onslaught of racial injustices also plays a role in our mental well-being. Let's shift now to young people. Suicidal thoughts, plans, and attempts are on the rise among Black youth. And Black youth is defined as those who are between the ages of 18 and 25 years old. While still lower than the overall US population, here are some striking stats comparing 2018 prevalence to 2008. About 9.5% of Black youth had serious thoughts of suicide in 2018 compared to 6% in 2008. 3.6% made plans to commit suicide in 2018 compared to 2.1% in 2008. And 2.4% made an attempt at committing suicide in 2018 compared to 1.5% in 2008. All right, So I think you'll all agree that it's definitely time for us to act. With that said, I would like to pause now and share with you a video clip and ask that you please think about the following. Think in terms of what your initial reactions to the video is. What are the key players in this? Who are the key players in this story? And what role does the community play in this? I'm going to share this once again.
Children, man, what's happening?
What happened? I just did because since they ignore me, they go, they come back. You understand? So this Sunday, you just come. When you pass for by the way, you just come. And they eat in the afternoon. As usual, I call it, they come up to do that. I finish our prayer. The mass what they do. So he can't come. He need my P21. He need my passport. He just needs some few things. I know it to talk. I know it to answer. You understand? You understand?
Baby, come. Baby, come. Leave on. Come by yourself. Leave on.
Don't go there, may not go enjoy yourself. Not go there because broken things cannot go there. You understand? So when he can't come my room, say when I give him, I don't give him. He can't go carry my stuff for my room. They begin to what did you want for? P21. What do you want use P21 for? He said he want to apply for his school thing for what? For UCD. Say UCD. What do you want use? You don't need your DC for the. I don't even answer. He can't come for me. Come tell me say make I give him the passport. You understand? So when I come tell and say, you know what? Call your dad. Your passport is already expired. Your dad, call your dad. Because if Papa said, let me and I don't go to school, I need to make a tell and make it call. I come and say, call your dad. You can't say if I don't give him, must. I can't go to the room because I know what that's the why they treat my things. Go upstairs, go see how it's happening. You can't carry the bag and the documents. They look for that. I said, why would you take my stuff without asking me? He said, why are they ignorant things? Are they ignorant things? And they ignore and say, so now I need to talk myself from there. Say I must give up. Now your own. Now your own. I just ignore. I don't think I leave and see you go come. You understand?
What did you got?
Oh, the children coming.
Children are stopped now.
Make him finish what he did to leave him. We don't do the worst, so make him make continue. The guy can't come. The only guy he can't come. So me and I come. The boss sees my car key, sees my phone. For waiting. I'm not gonna say give me my phone. Now you come. He say if I know, I can't. Me and I come. The drive. Say I can't collect my car key, collect my phone for you. Now here I come begin to destroy the things, they scatter the things. Say I must give. If I don't give, now here I come to someone. Not be your own. You understand? So when did you come finish in my eye? When
all this thing that you are. Hold on. That's why I came here. That's why I came here. That's why I came here for you to come and help me. All this thing that you are making now. Okay, will you come and talk to me? Come and talk to me. Come and talk to me. Okay, come and talk to me. All right. Okay, yeah. You come. Come and talk to me. You come and talk to me.
All right. Okay. So really quickly, a rough translation of what transpired in the video. First, it looks like this took place in a European country and the people in it are of West African heritage. According to the mother in the background, this young child, who's maybe 16 years old, is demanding for his legal documents, a passport, so that he can apply for college. The mother informs him that the passport has expired and the young boy needs to speak to his father. The young boy is upset about this and begins to tear down, so to speak, the house. An uncle figure steps in and tries to help take control of the situation. I will now hand over to Dr. Nadir to continue this conversation.
Thank you. I'm sure many of us have lots of different perspectives on what we just saw. We'd like you to kind of think a few minutes about that. And while I'm introducing our experts, I'd like you to share some information in the chat about, you know, your thoughts with regarding and your reactions with regarding the video and what you saw. So as you do that, I'd like to introduce our experts this evening. First off, I'd like to introduce Imam Nadim Ali, who is a licensed professional counselor. He has over 30 years experiences in the field of social services. He's a community activist and a wellness advocate. He's a husband, father of 5, and is associated with Holistic Stress Control Institute. He has a strong interest in helping people overcome the psychological and spiritual blockages that contribute to their individual and relationship dysfunctions. He conducts premarital marital therapy in an effort to help couples identify and heal from destructive patterns. He helps adolescents get over the hump of life called adolescence and helps them navigate life without drugs and alcohol. He also helps emotional intelligence. He also helps people identifying their underlying causes of anger and imparts skills to help them increase their emotional intelligence. Imam Nadim specializes in relapse prevention to help recovering people attain and maintain sobriety. And he integrates stress management techniques such as Tai Chi and Chai Kang into his practice as a means of managing stress holistically. And there's information about all of the experts on the website for the AFIA project. I also want to say that he combines his professional practice as a licensed professional counselor with his spiritual practice and his work as an imam in the Atlanta, Georgia community. Next, I'd like to introduce, and Imam, just say salams.
Assalamu alaikum warahmatullahi. It's Qigong.
Qigong, okay. Alhamdulillah, thank you. Next, I'd like to introduce Islamia Adebunhun. I'm gonna ask everybody to forgive my pronunciation. I worked on it, but please forgive me. Islamia is a mental health professional interested in dismantling systemic racism in education by challenging antiquated ideas, introducing equity, and providing access to Black students, particularly those of the diaspora and other students of color in education. She embarks on her 10th year as a professional school counselor, where she's worked in both the public, elementary, and high school levels, and private school systems as well. Islamia received her Master's of Science in Mental Health Counseling with a specialization in school counseling from Johns Hopkins University School of Education. She currently works in Saudi Arabia at the American International School of Jeddah. She is the founder of World Advocate for Youth Success, or the WAYS Initiative, and you can find out more information about her also on the website, and there'll be some her Instagram information there. Sister Islamia, will you give salams, please? And I don't see her. Do you see her, Dr.?
Yeah, she's on. I know she's at the airport though.
Oh, okay. Inshallah, we'll hear from her a little bit later.
Assalamu alaikum.
Wa alaikum salam. Thank you for joining us. We'll hear more from you in a little bit.
Yes, yes, yes. Thank you.
Thank you. And next, I'd like to introduce Sister Letitia Ajourier. She is a nationally certified school psychologist, educator, child and parent relationship trainer, business owner, and most importantly, a Muslimah champion for change. She inspires resilience and compassion as she brings a personal and professional perspective to her scope of practice that leaves students and families equipped to affect change in their lives as they improve the trajectory of their children's lives and familiar relationships. Her biggest inspiration is the mother of the believers, Khadija radiallahu anha. As a result, Sister Letitia is the proud owner and operator of Kareem Education Consulting Services, LLC, where she is equipped to provide school psychology services to 25% of schools in the United States from Arizona. I'm very happy to say she's in Arizona. Her formal education includes professional diploma in school psychology, Masters of Arts in educational psychology, and an additional graduate level training in play therapy and child and parent relationship therapy from the New Jersey City University. As I said, she resides in Arizona with her husband. Sister Letitia, please say salams to everyone.
Assalamu alaikum, everybody.
We thank you for being here, and we look forward to hearing from you. Next, I'd like to introduce Sister Aziza Ashkabe, and you're going to correct my pronunciation, please, when you come on. She is a family nurse practitioner. She has over 14 years experience in nursing. And since December 2016, she has worked in mental health and substance abuse in the underserved population as a family nurse practitioner. Recently, completing a postmaster's degree in psychiatric mental health nursing in May 2020. Sister Aziza's ultimate goal is to improve knowledge and facilitate better outcomes around mental health issues with minority groups, especially African and Black communities. Sister Aziza, would you please give salams? Your microphone is not, yeah.
Assalamu alaikum, and it's Ashakbe.
Ashakbe, thank you. Appreciate that.
You're welcome.
And then lastly, last but not least, I'd like to introduce, let me see, Dr. Abiola Adelaja. Not good, I know. I did? Okay, good. Dr. Abiola is a board-certified psychiatrist in general psychiatry, child and adolescent psychiatry, and forensic psychiatry. He has practiced psychiatry in multiple settings for over a decade, treating children as young as 5 years old to adults in outpatient settings and inpatient correctional and maximum security forensic settings. He is also an assistant professor of psychiatry at the University of Rochester of Medicine in New York. His private practice involves consultations with attorneys to answer mental health related questions in legal settings and in school districts. He will be joining us tonight to provide clinical perspective to our discussion on mental health and well-being. Wow, wow, mashallah, what a distinguished panel that we have with us this evening. So thank you all for joining us. So I'd like to, oh yes, please say please say salam to everyone. Thank you for being here. Well, I am so impressed with everyone's background and very happy to have you all with us this evening. So first of all, then I'd like to, now that you all have, and the chat is open for more and more people to just kind of share their thoughts about the video. But as you do, I'd like to start off with Imam Nadeem Ali and ask you to share your thoughts about what we saw in the video, as well as to address the question, how do we incorporate mental health and wellness with our spiritual connection to Allah?
So big question, inshallah. As far as the video, if you didn't know what was going on, it appears as though the young man was having a tantrum. And, you know, and we talked earlier about emotional intelligence. And as for our youth, we have to basically be able to increase emotional intelligence, which is the ability to handle any situation in an appropriate fashion. And so if you just saw this young man just basically tearing up the house, then in Georgia, we call it the 1013. You may think that he's having a psychotic break. And so if you're a threat to yourself or others or having some type of psychosis, in Georgia, we have a crisis team that could be able to bring, we can bring people into the house, counselors and social workers, and they will be able to, you know, basically take this young man to a hospital for 3 days. You know, but it appears specifically with all of the noise going on in the background, he was just acting out, you know, for the most part. You know, and so that's one of the things we have to look at. A lot of times we will misconstrue a person who is acting out in anger for a person who's maybe having a psychotic break. And so it's important for us to be able to talk to the person and to be able to see what's going on. You know, that's, you know, my take on the video. In regards to Islam and using the aspects of Islam and mental health and basically creating wellness, I reflected on, there was one of my colleagues in one of the hospitals I do assessments at, and she asked me how was I able to maintain my balance in these particular settings. I go into emergency rooms and we're dealing with all sorts of people. And I tell her, you know, I start, before I go into that place, I'll make prayer. You know, I'll be reciting Ayat al-Kursi and Falak and Nas, because there's just so many, you know, I'm a practitioner of Tai Chi and Qigong, and it's just being a Muslim, we are also aware of energies. You know, it's just, the world is just not this physical place. You know, it also has metaphysical concepts. And so we have to understand that we have to take care of ourselves on a mental level and a spiritual level, as well as a physical level. And so in Islam addresses all of that. You know, the Quran tells
I'm sorry, we're having a hard time understanding the Imam. Would you all please mute your phones, mute your lines so we can hear the Imam?
Yes, and Imam Nadeem, please re-unmute. She had to mute everybody out, so please unmute yourself. And
all right. How's that? Yeah, what it was saying is that the Prophet ﷺ said that your deen is on your friends. And so that tells us that the people that you associate with. And when I sit into 12-step meetings, I hear so much Islam in these 12-step meetings, even from the concept of the higher power, you know, to the whole concept of, they say, change your playgrounds and change your playmates. Because the Prophet ﷺ said that having good friends is like having the perfume merchant as your friend. He smells good and you'll smell good. Having bad friends is like having the blacksmith. And I guess today's equivalent would be the mechanic. They may smell bad and it'll make you smell bad. And so it's important, you know, that we start to recognize that Islam gives us so many concepts that people go for PhDs to gravitate towards these concepts. You know, if you look at the whole concept of one day at a time, the Prophet ﷺ said that. You know, we look at, who was that? Omar Khayyam. Yesterday is dead. Tomorrow is not yet born. Do what you can do to make today sweet. 1,000 years old. You know, and so when we look at our deen and then compare it with evidence-based types of thoughts and research, then you'll see that the Prophet, peace be upon him, who was an unlettered man, he basically gave us a wealth of information on how to deal with mental illness. Even when you look at the word for insanity in Arabic, it talks about majnoon, and if you literally, it means to be possessed by jinns. And in Europe, what did they do when people were hearing voices? They would drill holes in their head to let the voices out, you know? And so we have to understand that Islam recognized insanity even during that time. I remember I read about the hadith where the lady was asking for the hudud for adultery. And the Prophet, first thing he said, you know, are you crazy? You anti majnoon? And then, you know, then when she insisted on getting the punishment, then he said he gave her the punishment, but she she would be basically she would be mostly forgiven because of her getting this punishment in this life. And so Islam from its inception talks about people who are, basically are suffering from mental illness from its inception. And so we as Muslim practitioners, we can pull a wealth of information, even if we just look at the verse from Surah Rahman, in which of the favors of your Lord do you deny? We recognize how, how Allah talks about that we will be tested, and we have to bear those tests with patience. We look at Surah Asr. Imam Shafi said, if only Surah Asr, verily by the token of time, mankind is lost, except for those who have patience and join in mutual teachings of truth with patience and constancy. There's just so much wealth in Islam, in the Quran, if we unpack it, from a holistic perspective, and not just use it from a religiosity, really engage in religiosity, because there's too much religiosity in all of the religions. But when we look and unlock all of the wealth and that is in the Quran and that's in the Hadith and in the Sunnah, we find so much information for wellness, for wholeness. Again, from mind, body, and spirit perspective as well. Inshallah.
Everyone, once again,
Thank you.
please remember to mute yourselves. I'm sorry. Go ahead, Dr. Nadir.
Okay, thank you. Thank you, Imam Nadim. Yes, we want to remind everybody, please, to mute yourselves out unless it's time for you to speak. And also, Dr. Fauzi,
log out and log in.
one of our tech people
hear
should
them.
be able to mute people out as well.
Yeah,
Okay.
we're working on that. Yes.
Okay. So thank you, Imam Nadim. We really appreciate your thoughts and sharing, especially on the video, as well as your experience, both professionally and spiritually in your work. Next, I'd like to ask Sister Islamia about the roles that school counselors play in helping with the mental health needs of all students, and especially the group that we are focused in on. Also, what does parental involvement look like?
Okay. So to speak, is everybody able to hear me okay?
Yes, we can hear you. Thank you.
Okay. All right. So from a school counselor perspective, when I saw that video, I knew something was going on. Didn't know whether it was an episode that the young man was having, or it was family issues, but definitely something's going on. And more than likely, it's a combination of all of these things. As a school counselor, I would hear about that. Typically what happens is the kid goes to school. The next day, if he does, he's still very upset, and something triggers him, and it's a fight, and he ends up in the vice principal's office or the principal, depending on the student's history. Then it comes to the counselor, and it's just, I don't know. It's a lot going on to try to see, but we usually see some school-related behavior that'll come out of that. If it's not physical, it's academic. That kid might go into class and all his teachers, send a note down saying he's not doing anything in class. Please come and get him. And it's we see the back end of it. Depending on the district, because child support services can be such a convoluted thing. Every district follows a countrywide mandate about mandated reporting. It's not, to report something, like if I heard something like that, I might report it, depending on the circumstances. It's not my job to investigate it. All I need to do is hear if the kid came and said, they're not giving me my documents, I've been asking, I would follow up on that as a counselor by reporting it. And then where it goes from there, it'll probably touch somebody else on the panel at some point in the paperwork trail. So it's hard. It's hard. Sometimes we hear about it, sometimes we don't. But somebody in the school is going to feel the brunt of that interaction that he had with his family member earlier, that weekday, whatever it was. And I'm sorry, the second question.
Unmute yourself, Dr. Nadir.
What does parental involvement look like?
Okay. We work with, in the public school setting, it looks very different than in a private school setting, because as a counselor, the caseload I would have in a public school setting is sometimes my caseload in public school, public high school, is the number of students in the whole private school. So the role of the parent, this is a sensitive topic. I would say for my African families, because kind of being in the middle, being a second generation student that went to school in the public school system here and in Nigeria, having Nigerian parents and interacting with other cultures, working with parents, it's sensitive. You just have to tread lightly. It's ultimately a conversation between what you've always done and what you should do today, given the student where they are, how different it is from where you were raised. There's a place for both tradition and innovation in child rearing practices, but parents have to be open to it, especially when you see students that have crises that show up in school. It's not just a matter of, I don't know what's wrong with this child. He can't, there's something going on. Might not be academic related directly, but there's something going on that we shouldn't ignore or only try to address with one or two ways, which is yell at him and take him to church or mosque. There should be a couple. That's my personal stance. It should be a combination of every resource at your disposal.
Thank you very much.
Mm-hmm.
Very important points, and just a very important recognition that school. This is a three-way process between the parents, the school, and the child. So thank you, Sister Islamia. And next, I'd like to go to Sister Letitia. Sister Letitia, would you share your thoughts? And I've been instructed that we're a little bit behind, so but inshallah we'll make up for time. But your comments are all very important. So please, what types of support can school psychologists provide to help students with mental health concerns? And how are parents brought into the picture? And of course, please share your thoughts about the video as well.
Okay, so in terms of the video, guys, I usually assess the environment, and the environment appears to be very chaotic, where it appears that the parents do not have those de-escalation techniques to support that their child. And so looking at the intensity of the video and the intensity of the environment, you can tell that this is probably not the first time that the child has behaved in that manner. Because I don't know about you guys, but I could not tear my mama's house up like that. It probably would have been like World War III, okay, or 4 or 5 or 6 or something. So the intensity and the duration tells us that that's probably not the first time that has happened. And so what we probably want to do is provide the family with de-escalation techniques. Okay, making sure that we're giving the child a safe space, also giving the child options as well. I mean, he's not a child, he's an adolescent, but giving him like some options. Okay, you can choose to, go in your room and sit down and listen to some music, or you can choose to, maybe, I don't know, if he has like a punching bag, use a punching bag or something like that. But the first thing for me that stood out that I wrote down was safety of everyone, safety for the adolescent, safety for the family, because as we could see, he's bigger than everyone in the household. And also just relaxing the environment. as a school psychologist, what would that look like? So that happened in the home, and like what Sister Islamiyat said, for the most part, what I've always tried to do as a school psychologist, because most people see us as like the test and place person. Oh, my kid has a disability. They can't read, they can't write, they're having an emotional problem. Can you test them so we can label them? What I have done, and I've made a deliberate effort to make sure I am more than just that on the campus. So being a part of the public safety committee, being a part of like every part of the well-being of the whole campus community, not just our students who have individualized special education services. Because I was working at a school where there were not too many Black students, maybe like out of a population of 900 students, probably like 30 or 40 of our students were Black or even less. I always tried to make myself visible to those parents so that whenever there was a concern, the parents felt comfortable. Is Miss O there? Can I talk to you? You know, this situation happened last night, or, you know, my mom passed away, the child's grandmother passed away. So they always pretty much felt comfortable. So establishing yourself on the campus as someone that parents are able to open up to and speak with. And so parents usually feel comfortable. And I've had Somalian parents, believe it or not, come and say, you know, can I speak to that lady who wears the scarf? I need to talk to her. Last night this happened, you know, where the student, you know, my kid is feeling a little down. They feel more comfortable when they see someone who looks like them and they're able to talk to the person. So just some really quick things. In the event that, you know, a parent called in the school counselor, for the most part, I partner really nicely with the school counselor and the school administrators to make sure they could always reach out to me. And hey, Letitia, we have this situation going on. I usually talk to the student, pull the student in first thing in the morning, whenever I'm able to. You know, I heard you had some situations, how are things going? Just to talk through the situation as much as possible. And then providing the parent with resources. I think that's very important. In this particular case, in this video, I think the parents also need those resources and those de-escalation techniques to help support the mental health and well-being of that child as well.
Thank you, Sister Letitia. Appreciate those points. Very important pointers, and giving us an understanding of what your work would be differently than it might be. You know, we heard from Sister about school counselor, and then the difference in terms of a school psychologist. So thank you very much.
One more really quick point, guys. If I don't see the behavior happening at school, because whenever I'm able to test and look at things like an emotional disability or anything like that, we have to see that behavior persisting at school. Children behave differently in different environments. For the most part, you feel more comfortable acting out and throwing all this stuff around in your home than you would at the cafeteria at school, right? Because you don't want your peers judging you. So if the behavior is not happening at school, what we do is provide resources. If the behavior is happening at school, then we escalate it to look at more their mental health needs that are beyond, you know, what is provided in the general education curriculum.
Good, thank you so much. Now, Sister Aziza, what substance abuse concerns do you see among youth, especially among our Muslim youth these days?
Okay, Assalamu alaikum. So like Sister Letitia said, my reaction to the video was pretty much similar to hers. I thought he had a mental health issue that was escalating, particularly some type of psychosis that was going on, that the parents obviously didn't know how to handle, or, you know, it's happened before and they definitely don't have the handle of how to de-escalate it. And for me, the biggest thing was safety, ensuring his safety and ensuring the parents' safety, making sure that everybody's safe, first and foremost. On my side of the thing, I also wondered if there was some kind of substance abuse or substance use going on with the kid that would definitely induce psychosis, because a lot of substances are known to induce psychosis, i.e. alcohol and cannabis. Cannabis and other drugs are very prevalent in the Black society. We have high incidents of use disorders in almost every aspect. I've been working with substance use disorders for the past almost 4 years. And when I talk to the kids, to the adults, and even kids, I worked in a school system for a little bit. talk to kids as young as 10, 9, starting substance use at that age. I think the biggest thing is knowing what contributes to use disorders and knowing that these substances can induce substance abuse in kids, even Muslim kids. I think our religion sometimes negates the fact that people are struggling and they seek ways to deal with their struggles, i.e. depression, anxiety, and not even being able to cope with, the home, and that creates problems for these kids. So for the Muslim kids, I also have dealt with a lot of kids with Muslim kids with substance use disorders. And their biggest thing when they talk to me and tell me how they get started is that, there's nobody addressing their emotional needs. And it's all religious, or, all religious advices that that's not helping their situation. So I think paying more attention to this children's mental health needs will help curtail substance use disorders, especially within Black kids and Muslim kids.
Thank you very much. Really good points. I think so many of us are not aware of the role of substance use and abuse, and also co-occurring disorders, both mental health and substance abuse, and its impact on our young people. So thank you for your work, and thank you for sharing your comments. Now, we go on to Dr. Abiola. The question, of course, we'd like to hear your thoughts as well as about the video, as well as when should people begin to entertain the idea of treatment for mental illnesses or disorders, and what are the treatment options out there?
Assalamu alaikum wa rahmatullahi wa barakatuh. Regarding the video, my first impression was, I agree with all the other speakers, by the way, that have spoken earlier. And I believe that there's more to the story than what we're just seeing in that snippet. And in cases like this, early intervention and identification of symptoms and signs of mental illness is most important. Before the kid got to this stage, he might have experienced multiple layers of depressive symptoms that could have led to some other types of personal interventions, like using drugs in order to calm himself, not having the right type of support systems either. Most importantly, family members who understand how to talk to their children or address or identify early symptoms of depression or anxiety. It's hard to tell if he was psychotic, but it was very clear that he was angry, and it was some kind of externalization of an internal conflict. So his intention to make his parent appreciate his level of discomfort was, in my opinion, out of proportion. But it was a clear message: when kids act out in this way and they destroy property, it's just a cry for help. So I would say that it would be good to understand the background information about the current symptomatology. And with that, you need a lot of collateral information to really understand how this began. And you would typically want to take it back to using the biopsychosocial approach, where you want to understand the genetic predisposition in this family, and especially in this kid, for some kind of mental disorder. So you will also want to understand his current psychological state, and of course his social environment. So all those things play a key role in how you address this situation. The other question, so that's about the video. The question regarding treatment. So my desk is typically the last bus stop. when all the interventions by the therapists and the psychologists have not been effective, then they would typically recommend some kind of treatment. Typically, there are two types of treatment. And from my perspective as a physician, you look at therapy, which would have preceded the case coming to my table, and then when they realize that the interventions are really not working, they may say he might need a psychiatrist to see this case and decide if he needs medications. But I would say that sometimes the medications are not the answer to everything. Sometimes we'll do some assessments and realize that you need to have some, parent, perhaps some family therapy. So if you are having some miscommunication between the child and his mother, then you probably need to have a sit down and have a professional family therapist to be the conduit for communication. So if the mother is not hearing what the child is saying, you may need a third party to intervene. In particular, we should not we cannot minimize the importance of the extended family system, which we benefited from in Africa, where you had multiple people in your home, uncles and aunts, people that will hear you out and communicate to your parents what you're feeling, or even be your source of mental health support. So we all know that not many of us would run to a therapist in Africa to say, hey, I'm having a hard time. We had this extended family system that was very robust and very helpful. So in this isolated society called America, it's kind of hard to have a lot of people being there for you because everybody's about their business, working and trying to make the almighty dollar, and nobody really pays attention to what's happening around them. So the value of the extended family system cannot be overemphasized, and the importance of observation and parents paying attention to what their kids are going through should also be noted. I'm going to try to shorten my answers because there's a lot to talk about, but I'll try to make the narrative as short as possible. In terms of treatment, I think I answered what should people begin? Yeah, when do you entertain the idea of treatment? So you start to think about treatment when you have a disruption in social and occupational functioning and or school functioning. So when you realize that an individual, be it a child or an adult, has gotten to a point where they're not able to meet their daily requirements or function in their natural environment. It means that they are getting to a point where they need an external party. And again, treatment could be inpatient or outpatient. In this kid, you may require some kind of, it depends on how he responds to the de-escalation techniques, like the other speaker had said. If you realize that it's getting out of control, and safety is always paramount. So if it becomes, if he's able to be appropriately de-escalated, then you can have the kid go for some kind of outpatient, therapy or counseling. And in particular, family therapy will be helpful, and also individual therapy on how to manage distress tolerance, cognitive behavioral therapy, sometimes dialectic behavioral therapy. All this have coping skills to address discomfort. Secondly, when he gets to a point where he requires hospitalization, then he's a potential danger to himself or others. In my opinion, this kid at this point almost rises to the level of hospitalization. However, if the family is able to de-escalate and avoid any kind of ambulance coming to the house, causing some kind of unnecessary attention to themselves, it will be important to get some kind of outpatient treatment. But if he's threatening to harm somebody, breaking windows, people could potentially be hurt, at that point, you just have to call for help. At that point, you may end up calling 911, and the ambulance may have to come and take you to the emergency room. Nobody really wants to get to that point, but when you realize that people's lives are in danger and this kid may end up hurting somebody, you don't have a choice. So
my take would be early intervention, identifying the risks, identifying, knowing your child is very important. When your child begins to feel not themselves, you really want to ask, have a conversation with them, make it an open conversation so that they can discuss with you what they are dealing with, so that you can have a dialogue as opposed to trying to impose your opinion on them. Look, we're in America and things are kind of different from the way we were in Africa and in African and in other West African or African communities. So having that conversation about how they're feeling and how we can help, I would say, is key. Thank you.
Dr. Abioli, just have 1 minute. Thank you.
Yeah, I'm done.
Oh, I was giving instructions, so they left. Thank you so much. Those were all important aspects and important points for us to keep in mind, especially from a treatment and early intervention. I'm a prevention specialist myself, so I tend to, you know, want to focus and try to get in there before we have the problems and to get in there as early as possible. But there are issues, so we do have to look at the treatment side of those issues as well. So thank you very much for sharing your points as well. So what we want to do now is we want to get feedback from all of us. There are, you know, a good number of us here. That means that this is an important topic, that people have concern about this issue. And it's something that we don't talk enough about. So this is a courageous conversation that we're having today. So what we want to do is put us all into breakout, smaller groups, so we can talk a little bit more about some of the concerns and some of the, like, next steps is really what we want to look at. So now we've heard some of this, you know, some of this may be very familiar to many of us. Some of this is new information for some of us. So then the question is, what do we do next? You know, what do we do next in terms of, you know, mental health and Islam? You know, like, you know, from a religious standpoint. So Imam Nadim will be in that room. What do we do next in terms of advocacy? You know, there's so much stigma around these issues. What do we do next in terms of advocacy? And then what do we do next in terms of coping with mental illness? So we have 5 groups, and so we're going to go ahead and go into our breakout rooms. And when you see that, just accept that so you can join into that breakout room.
Right.
Thank you, everyone. And we'll be back shortly, so don't leave.